Introduction. Rather than introduce everybody at this stage, we'll introduce ourselves as we come in response to your questions. What I'm going to suggest is we start with a video and then we'll follow on with the questions and discussion after that. So over to the video. Thank you.
We have a significant opportunity right now to enhance the quality of people's lives by investing in mental health services provided in Leicester, Leicestershire and Rutland. Our mental health heavily influences our whole health and well-being, and it's as important as our physical health. We at the NHS recognise this and are investing more in local services to dramatically improve care and treatment. We want to help everyone living locally to thrive and live the life they want. We've been working with individuals for some time now to really understand what they want in their mental health services. We've worked with people who've experienced our services, staff and stakeholders to develop key proposals that we want your views on. Our plan covers two key areas: investing in and improving services for people when their need is urgent and when they need planned care and treatment.
How can we make sure that we use our resources and our investment for the best needs of the whole population, and that we structure our services to meet service users' needs and carers' needs in the best possible way? We think we've done lots of good things around that, but we think we've got lots of ideas within this consultation that will make it stronger and a better service for people, and a more integrated service for people, an easier service to navigate, and there'll be better outcomes for people and their families.
When the need is urgent, people said they wanted an easier way of getting help at any time of the day or night, and they wanted to get this help quickly and directly. This feedback underpins our proposals for change. We want to deliver better advice and guidance, so when people are first looking for support or even just information, they can find it all in one place online. When individuals need more help or are in a crisis, we recognise it's important there's a place they can contact 24 hours a day, 7 days a week, by phone or text. We want to introduce a new central access point for people so they can do this.
Patients have been able to call us directly if they were struggling without having to attend A&E. So therefore that's actually reduced the number of people going to A&E that could have access to mental health services without any other service having to refer them.
An important aspect of the central access point is the crisis service. This means people can get help directly without contacting their GP and get an assessment within 4 hours if the need is urgent, and within 24 if it's less urgent. Crisis cafes also offer urgent help. We have 3 already, and they provide a safe space for people to get help when they're experiencing a crisis. We want to increase the number to 25 and are asking where people want them located and what services they could provide.
The Crisis Cafe is a really important part of what we do to support people in the community with mental health issues. It's somewhere they can come where it's safe, it's a welcoming environment, and we help them in terms of looking at what is causing the problems. It may well be that there's a financial issue, the relationship issue, it may well be it's a mental health issue itself that's the problem, but a lot of the time people actually just need someone to talk through their issues, get the help that they need and meet other people.
We want to increase the mental health support in emergency services to better support individuals when incidents occur. We're proposing to expand our existing triage car service to work longer hours and cover both police and ambulance services. During the pandemic, we quickly set up the Mental Health Urgent Care Hub to provide more targeted support away from the emergency department. It's a space the emergency services, social care or other health professionals can refer into and offers people a rapid assessment and support. Through our proposals, we're looking to make the changes permanent. When people experience ill mental health, they may go to the hospital's emergency department for help. There's now extra expertise there 24 hours a day, 7 days a week in the emergency department. This is called the Acute Mental Health Liaison Service. It also helps people who are already on a hospital ward. Finally, there are individuals who are particularly vulnerable, who need mental health support urgently but for various reasons don't access it. There are currently 3 teams working with vulnerable groups, including homeless people and individuals that present in the criminal justice system. We propose to bring these teams together into one dedicated service to help more vulnerable people access the care they need. So to improve mental health care for people who need urgent help, we want to provide self-help and guidance, further develop the central access point, create more and strengthen the role of crisis cafes and improve crisis services, expand the use of the triage car, introduce permanently a mental health urgent care hub and an acute mental health liaison service, join up services that support particularly vulnerable groups of individuals with mental health needs that do not access the support they need. The second key area is improving planned care and treatment. People told us they wanted as much care as possible to be provided near to where they live and be organised around their needs and the needs of their local community. We've listened to this feedback and developed the following proposals. We have a number of teams working separately, with some work being duplicated or triplicated, and long waits as people are passed between different teams. We want to bring these together into 8 new community treatment and recovery teams, working in local areas to support adults. They would work alongside an additional 8 teams who would focus on specific mental health needs of older people. These local teams will be supported, if needed, by other experts to provide more focused support. This includes help for women pre- and post-birth, and for people with complex personality disorder, also those with early signs of psychosis, difficulties with memory, and for individuals that have complex needs who will benefit from community-based mental health rehabilitation to support their recovery needs. So our plans are to work with local communities to provide better planned care and treatment, reduce waiting times for treatment and join up services to create a local seamless experience, improve support for individuals with personality disorder, improve services for people of work age and older people, expand perinatal services for the time immediately before and after birth, and develop a maternal outreach service. Improve the experience for people with potential psychosis. Reduce the wait for a diagnosis of dementia, and provide rehabilitation support to help people recover from complex psychosis.
This is a once-in-a-generation opportunity for us to deliver the mental health services that people in Leicester, Leicestershire and Rutland truly deserve. Please take your time to have your say, whether you've used our services now or in the past, or simply know somebody that needs or relies on mental health services. We want to know what you think. Visit our website, complete a questionnaire and help make a difference. Step up to great mental health today.
Okay, thank you. So I hope that short video just helped to give you an idea of the range of things that are under consideration. It's a really broad program of investment, and we're really keen to get to get your views on it. So I can see Helen has just put some information in the chat space if you've got questions, and really happy to pick those up from the chat space, or if colleagues would like to raise hands. So I'll allow just a moment to see if anyone's got an immediate question or an experience they'd like to share. If not, what we'll do, I think, is just start to elaborate a little bit whilst you have a think on some of the detail of the proposals, and in particular just try and draw out some of the kind of background information. So allow me to introduce a colleague of mine, Gordon, who works within the mental health service itself, and perhaps Gordon, you could just give us a bit of an overview from your perspective.
Yes, thanks, Andy. Can people see me? Is my video working?
Yeah.
Yeah, fine. Yeah, I mean, I think the film's pretty helpful in outlining some of the key things. But if I just take a couple of minutes, I think just to be really honest about, I think, some of the things that we're trying to do. And I think it's fair to say in this system, in this part of the world, in Leicestershire, Leicester and Rutland, as well as other parts of the country, mental services have really struggled a bit with a few things actually over the years. One is waiting times for some services, particularly some of the planned care services, particularly some of the psychological therapy services that people need, but even just general secondary mental health services. And that's something that's been at the heart of our thinking for some time about how do we fix that. And part of the consultation is around how we can really make the improvements to services and the changing ways in which services are configured, without going into all the detail, but just trying to make it all a bit simpler so that we reduce the sort of weights that can happen in the services themselves between different aspects of it. So in a very simple way, we're trying to reduce some of the barriers within some of the teams so that people, once they're in the service, don't have to wait then and get bounced around in services, and sometimes bounce back to the GP, which is kind of really unhelpful, I think. So there's a lot of work around that, and it's quite technical, some of it, but it's not technical for the sake of being technical. It's technical because we're genuinely trying to get rid of waiting times and make it improve. So that's a big part of this. And I think the other thing to say is there's a huge component of this that's about also how do we use the genuine investment that's coming our way. And we're having, in my view, and I've been involved in this work for many, many years, a fairly unprecedented level of investment coming in, particularly around what we call serious mental illness, and how do we use that wisely, and how do we make sure that we get our services more integrated and in the right place to do that. So there's partly about using your investment in a good way, partly about getting rid of unnecessary problems we think that exist within some services around bounce around and around waiting times, particularly around planned care. And I think the bits in the video that talked about urgent care were really interesting. Some of those things, like the CAP and the hub that were mentioned, are already in place through the pandemic. And I think if people were watching the video, they'd see that. So this is about, kind of thinking about how we can make those really sustainable and permanent, because we've seen some of the really positive improvements that they've made to people in terms of making it easy for them to access. So there's a few things there. And I think the other bits that I think are worth mentioning is that this isn't something that's just been thought up, in a sense, this year, a load of professionals. This work has been going on for 2 years, and I'll be very careful that the language I use, but I think it genuinely has been co-production. It generally has been a real partnership between service users, clinicians, and some of the managers and some of the other people that work in the trust. And if I could go on some time, Andy, about all the different workshops that have taken place, but during the start of this work around 2 years, 18 months ago, there was something like 50 workshops with service users and carers to, in a sense, design the work that's gone into this consultation. So there's a lot of history and backstory to the way that this has been done. I think the really important piece of this is that our view at LPT is that service users and carers know what they need, and we've hopefully tried to reflect what they need and what their views are within the consultation and within the proposed changes. But I think we've got an awful lot more work to do, actually, and I'll say this openly, about making sure that we take those service users and carer voices forward, and really go, once the consultation's finished and we look at kind of how we can potentially implement some of the proposed changes, that we really do that in partnership with our services and carers, and a real genuine partnership, because I think that will be the key to making sure that what we do genuinely makes a change. I think services have a tendency to develop partly organically, but partly potentially because it's the way that services develop, not necessarily in the way that reflects service users and carers' needs. And that's one of the things we want to really kind of change. And I think the last thing to say is there's a big focus in all of this on, I suppose, what we'd call the equalities agenda, Andy, but by that I mean really strongly thinking about our population and the specific needs of the population as a whole, but also specific groups within the population. And we know that mental health has a disproportionate impact upon some groups and on some parts of Leicestershire and Leicester and Rutland, and we need to be cognizant of that and make sure that we've got some real thinking around how we do that properly. So we think it's really exciting. You know, it's not very often that there's this level of investment that comes along. So the opportunity to do something really, really interesting and really new and genuinely, I think, transformative in terms of the way we're going to land services in the next few years. I think it's, even for somebody who's been around for a long time like me, this is really, really exciting stuff. So, I mean, I won't talk too much longer about the detail. Psychological therapy services is the one I'll finish off on, just to say we've got a number of different psychological therapy services, all with their own challenges around weights. And if people have seen the consultation, they see that what we're trying to do is embed those much better into the wider CMHTs and planned care teams, as they're going to be called, to make sure that we reduce some of that bounce around. So without going into too much detail, that's probably just a bit of extra added information around the edges, Andy, if that's helpful for you. And
yeah, really helpful. Thank you, Gordon. And good to get a bit of a sense of the work that's led up to this point as well, which is extensive. Thank you. So can I come to Jane? I think you indicated you wanted to come in. So Jane, over to you.
Hello, thank you for putting on this meeting. I am a member of the general public, but have a sort of vested interest around mental health. I teach mindfulness to children and adults and resilience. So I have, I think, 3 questions. So would you like me to sort of say one at a time, or just reel the 3 off?
Put all 3 questions out there, Jane, and then we'll do our best to, well, certainly note them all, and we'll do our best to answer them as well if we're able. Yeah.
Thank you. So just a thought around the Crisis Cafe, because I live in Rutland, thinking around the rural community that we have here. People can have difficulty getting to Leicester or somewhere where there may be a Crisis Cafe. So I was just wondering whether there may be, it's just off the top of my head, like a crisis bus or something that would be able to visit villages, you know, sort of more outreach stuff.
Okay.
Another one was around, I have a friend who contacted me because she's just recently had the all clear on some cancer treatment, but she's really struggling around her mental health, and she's on her knees actually, and the psychologist said, you're on my list, but I can't see you for a year. Have you thought about mindfulness? So she contacted me, and I was like, okay, that's great. Mindfulness is good, but it's also not always the right time to do mindfulness, especially with the trauma that she's gone through and where she is with her mental health. So my concern is that sometimes mindfulness may be bandied around as, you know, give that a go, here's an app, but actually it could do more harm. So there's just a little thought there. And also around how we support the generations coming through with their mental health, what things can be put in place so that can sort of maybe ease the demand on adult mental health a bit, or at least have things in place, you know, because I know the waiting lists are so long. And again, it's that sort of holding pattern for these people who are struggling, but also around their families. So, you know, what support can be put in place for the families when they have a member who's dealing with depression or something. Yeah. Okay. Does that all make sense? Sorry,
it does. No, look, really helpful questions actually, and really important. And we'll I think questions are also suggestions in a way, aren't they? And we hear them as that. So we certainly captured those ideas. But let me just kind of bring a couple of colleagues in, because it may be that we can talk to some of the specifics. So the first point was really around crisis cafes, rural access. Rosie, would you like to comment on that?
Thanks, Andy, and hi, Jane. So I'm Rosie Clare, and I am providing project support actually to improve the pathway in terms of how people access services, and also to get the service, you know, support when people do need urgent mental health support. So in terms of the crisis cafes, we've got a 3-year plan to expand that crisis cafe offer across all of Leicester, Leicestershire and Rutland. So in year one, obviously we're looking at what current demand is, and we're looking at sort of a slow expansion. So year one we'll have a number of cafes. I can't give you specifics around when around Rutland we will have that crisis cafe operating, but the idea is to have at least 25 nights of crisis cafes running across the whole of Leicester, Leicestershire and Rutland, where people can actually access that support in their local vicinity rather than having to travel into the city as they do now.
Okay, thank you, Rosie. You raised two other really important issues. One is the timing of access to services, really, particularly for those people with physical illness, where there are psychological components or related mental health issues. And then this also equally important issue about prevention, really, and starting to think about how we work with the younger generation. Is particularly topical, of course, given the profile around this last 18 months and COVID and the impact that's had on younger people. Gordon, I don't know whether or not you can comment on either of those.
I can briefly. I mean, first, what I mainly wanted to say was what an absolutely brilliant series of questions. I mean, I think one of the things about doing these consultations is whilst a lot of this is about how LPT changes some of its services, and it can be a bit technical, one of the things we wanted to do with this is to genuinely start a conversation about wider mental health, which is about all of the different mental health that's provided, some of which is provided by LPT, some of which is provided by GPs, some of which is provided by people like Jane, actually, in terms of mindfulness support. And I think so three things. Firstly, so thank you, basically, and all of that will be informing our thinking going forward as a system. I'm sure Alison would agree with me on that. Firstly, the Crisis Cafe, just to pick up on Rosie's point, I lived in Rutland for 10 years, Jane. I totally get, you can't get a bus for love nor money half the time. And if you don't have transport, it's really difficult. So we will be looking at a range of innovative options, including potentially some mobile options. But I think initially we will absolutely, we'll look at those, but I think what we can commit to is absolutely, we're really clear that a crisis cafe option will be included in Rutland. And we'll be working with the local population about where that best works. And I won't give you the name of all the villages because you'll know them. But yeah, we'll do that work. Yeah, I was in one of the smallest. So the mindfulness bit, I think, was fascinating. I think you're right. I think that the level of support that people get at the right time is really crucial. And sometimes mindfulness can be really helpful, but it sounds like in some cases people need a bit more than that. They potentially need access to WIPE. Now there is, there are specific services within IAP, for example, which is the talking therapies that people can access by self-referral or GP that LP doesn't provide, but colleagues of ours provide from another organisation across the system. And I know that that's something that Alison and colleagues are working on in terms of the wider sort of pathways for support into that, including what we call long-term conditions, including access to people with cancer and including options for that. So I think you're absolutely right. We need to think very carefully. And actually, if we get the waiting lists right for psychological therapies, we'll be able to improve the access to all, including people who need support either through cancer or some other long-term or serious diagnosis of physical healthcare, because we know the links between physical healthcare and mental health are really strong. So that's something that we are thinking about and working on. So the question was entirely right. The third bit, I think, is a really, really important piece, and I don't have an easy or glib answer to it. And I think it warrants a real genuine conversation actually about how do we as a system think about the well-being and the resilience of young people as they come through school, as they come through their early adulthood, and how can we support people? Because we do know actually that a lot of the mental health, the adult mental health services, which broadly this consultation deals with, are actually already established by the age of 16, 17, 18. The overwhelming majority of that. So we've got some good thoughts as a system about how we can make the children's services and the adult services work better together. And conversations around mental health in schools are taking place at the moment, and Alison and colleagues know about that. So I think there's just a lot of work to do on that, and I think it's a wider societal piece as well as the mental health piece. But I think there is something as a system that we want to be thinking about in terms of supporting people, and I can use all sorts of fancy words like through transition or through various kind of pathways. But actually, what we're really talking about is how can we make sure that we support people, and potentially at the same time reduce the demand on secondary services at a later stage. And that is, in a sense, that if we can do that with one, really, haven't we? We've really cracked it, and nobody's cracked it yet.
And I think it's.
But as a system, we are having that conversation. When I say as a system, I mean as a group of people who work in different organisations, but all kind of trying to improve mental health services. So yeah, being part of that conversation, if you've got an interest in it, would be fantastic, Jane, and we'll be really happy to kind of, we want as many people involved in how we do that as possible. So no easy answers there, Andy, but I just, what a great start to the.
Yeah, I mean, it's important for us to understand the questions being asked, because the question is a suggestion to a solution, isn't
Absolutely.
it? What are we going to do about that is the challenge we take away. But so that's really helpful. We've got a group of questions now. So just to make sure that everyone understands I haven't missed you, I think we've got a really interesting comment and question from Ruby regarding support to carers, particularly, not just in coping with the kind of physiological side of things, but the psychological side. And we've also got a comment about the particular impact for different ethnic groups, which I think is really helpful. Thank you. And I've got a couple of hands raised as well. So Matthew and Eric. I think what I'll do is pick up, first of all, just bring Rosie in, because I think you might want to say just a little bit more about the kind of children's side of things. And then perhaps we can just think a little bit about the support to carers as well, and whether someone can come in and talk on that. So Rosie, over to you.
Thanks, Andy. I just wanted to really build on what Gordon's already said. So in terms of what we're seeing at the moment in our, hopefully you're aware of our mental health central access point, which is a new service that we implemented when COVID first hit in April last year. So we are having joined up pathways with our children and young people services as well, so that we are trying to be helpful and provide support and signposting, not signpost, support for people who need it. It could be parents, it could be carers, it could be children themselves. We're also seeing an increase in numbers of people coming through our A&E service as well. So we're looking at putting some mental health practitioner expertise within that team as well, so that we can be responsive to what we're seeing. And I think Leicester and Leicestershire and Rutland being in a unique situation of having 3 universities, and people feeling quite isolated away from home. So we are recognising that crisis cafe, we're trying to implement a crisis cafe within each of the universities as well, to try and provide support to our student population.
Thanks, Rosie. So we've got, Ruby, just to pick up, you've put a couple of additional issues. One is specifically responding to the needs of different ethnic minority groups. And then from the Carer Forum perspective, a recognition really of the suffering and trauma that people have experienced in their role as carers, and what we can do to support in those areas. I think in terms of thinking about how we work with different groups of people, one of the themes that we're kind of exploring throughout all of this work, and Gordon touched on it, is this whole idea of co-production, of trying to develop very specific and tailored responses, not for people, but with them. So with their active engagement as part of just the whole process in which we plan and commission services. I don't know, Alison, whether you're able to say anything about that in terms of the process we're going through to try and work out, what services to put in place, because this whole kind of co-production is at the heart of that, really, and that might address some of the questions that Ruby's been raising.
I actually think Ruby's point in terms of carers is a very good one, Ruby, so thank you for raising that. My name's Alison. I'm the Senior Mental Health and LD Manager across the 3 CCGs. And as Gordon was saying earlier on, it is quite an unprecedented time in terms of finances coming into the sector currently. So we're looking at how we can best work with people to ensure that we get the right outcomes for people. And I think what you're saying in terms of the work that's already there supporting the frontline staff, actually expanding on that is a very good point, Ruby. So, because I think we do have that opportunity to look at that service that we're delivering and look at how that can better suit the population. So I think that's something certainly that I'll take away and have a look at. In terms of the work that we're currently doing, we're actually putting together an independent, we're calling it PACE. So it's patient and carer engagement. So it's going to be led by our Health Watch colleagues so that we can ensure that we're collating all of the information and all of people's points all of the time. So not just when we're doing a consultation such as this, but so that we can hear what people are saying and what people need, so that it will always feed into some of our decision making going forward. So, and I think we'll have to pick up some more in terms of carers, and certainly linking in more strongly with the Carers Centre, I think, to make sure they're part of that ongoing conversation. So thank you, Ruby.
Okay, thank you. I've got a couple of questions, hands up now, so I'll come to those if that's okay. So Matthew, I think you're showing first on the list. Can I come to you next?
Yeah, thanks very much, and thanks for a really interesting and important discussion here. As you know, Andy, I until a year or so ago was chair of the LGBT Centre in Leicester, and I'm still involved in LGBT plus representation out here in Hinckley and Bosworth. So I'm going to ask you an LGBT plus focused question. You won't be surprised to hear. So the question is, how much you're going to be working with other agencies, because often for LGBT plus people, and I've written down a couple of examples of this. So it may be a trans person who experiences abuse on the street, and that leads to mental health issues, or it may be a gay young person who comes out to their family and is chucked out of the family home, and that therefore leads to mental health issues. So there's societal realities that can and do and are leading to mental health issues. And so I guess it's just how much you're working with the police and the LGBT Centre and others to try and help deal with the societal part that leads to the issues with that can lead to the issues with people's mental health. Thanks.
Thank you. So really a really good question. In general terms, there is a lot of joined up work between the various agencies, particularly through health and wellbeing boards and through kind of health promotion work. But when that's at a very general level, and I know perhaps doesn't specifically address the issues, but the thinking behind what's called the ICS, the Integrated Care System, which is the sort of way we're working, is designed to try and get the best of all of us together to focus on these issues. So council, police force, education, health, the voluntary sector, to try and tackle these issues. So the intent is certainly there, I think, Matthew, and there are some examples, actually just during COVID, where we can point to the fact that we've been able to do that. But there are plenty of others where it isn't joined up, actually, or at least not as well as we would ideally like. So, Gordon, I don't know whether or not you can talk about this whole issue really about how we kind of coordinate with others, and particularly how we tackle some of the issues about inclusivity, really, and kind of stigma, mental health, that sort of things.
Yeah, I can pick that. Firstly, thanks for the question. So the answer, in short, to the first part of the question, which is yes, we are engaging with groups through the consultation and outside the consultation. When you mentioned the police, I sit on their strategic partnership board, so we do a lot of detailed work with the police. I think your point around, I mean, I made this point at the start, and I didn't want to labour it too much, but I mentioned kind of the intersectionalities around potentially race, around some issues around to do with gender, to do with inequality of incomes, around a whole range of different intersectionalities that affect well-being and mental health. And actually some communities are absolutely disproportionately affected. And you mentioned the trans community. I mean, the figures for mental health issues within the trans community are quite shocking, actually. And really worrying. So, I mean, I chair the LPT, LGBT plus working group that we've got, and we've got a real focus in our organisation on that. We're always looking to work with as many groups as possible across LLR, and if we're not working closely enough with with some groups, then we absolutely will as a result of this conversation and through this consultation. Because for all the reasons you point out, I think it's incredibly important, not just trans people, but people across the LGBT plus group. So absolutely, that's a real commitment. And the reason I say all of that, Andy, is because I think if you get services right for people who have got specific issues related to kind of intersectionality and the kind of the determinants, as we call it in the business, poor mental health and the determinants of wider well-being, then you improve the services for everybody. So there are some very specific needs you need to meet about supporting people in terms of coming out, supporting people in terms of the issues related to transitioning, but there's also something around making sure that by doing that, you're actually kind of raising the bar generally for mental health services. So a big commitment from me to kind of picking up with the group that you mentioned and making sure that we're linked in with that. Generally, I think we are attempting to meet with as many NGOs as possible. Probably worth saying at this point, Andy, that the consultation itself is only about a half of the work that we're doing in Step Up to Great Mental Health. So Step Up to Great Mental Health also covers off a whole bit of other stuff that we're not talking about through the consultation. The consultation covers off urgent care and planned care. What it doesn't cover off, but there's also work going on, is all of the neighbourhood work that we're talking about. So all of the bits that have been discussed around how can we work with the voluntary sector, how can we make sure that we're addressing needs of specific ethnic communities and dealing with specific issues related to stigma in certain areas, and how can we also make sure that we're working with voluntary sector organisations, particularly those that have got a specific focus around specific groups that have got poorer determinants of mental health. So I think I just wanted to mention that because it doesn't necessarily come through the consultation, but it is a huge chunk of work we're doing. And I think there's something around just a commitment as a system to rooting out inequalities, because inequalities are a key determinant of poor mental health. And I think there is something about us not being shy about having conversations about the wider social determinants. I think there was a time, some years ago where services shied away from that and felt it was, too difficult or too complicated to talk about. I don't think we're in that place now. I think we should be really clear about where societal factors have an impact on mental health. We need to be in that place and having those conversations.
Right.
Okay. Can I just say, Andy and Gordon, and thanks for that really encouraging set of answers. Can I just say that I chair the police and fire services, independently chair. I don't work for either of them. Independently chair the police and fire services LGBT plus advisory group. And if there's anything in any way at any time that we can do through partnership working to reach out to the communities with some of these messages, do let me know. Okay.
Brilliant.
Absolutely will. Thank you.
That's really, really helpful, and thanks for raising that really important area. Ruby, I can see you've kind of put a request in for some further information. I can see Alison's picked that up. That's great. Eric, I'll come to you next, and then I haven't lost the question about the voluntary sector, so I'll come to that next. But Eric, if I can come to you next, please.
Hi, everyone. My name is Eric Waweru. I'm the director of the Center Project, a charity that works with vulnerable groups in the city. On the film that we saw, we talked about providing help and guidance, mainly through online, phone, and text. And that raised to me the issue of digital exclusion, because that's something we see quite a lot. People coming here to get support, actually to access some of the services that you've listed there. Have you considered how that can be improved? And also following that, the issue of community-based services. How integrated are you looking at in terms of existing services and new services and involving voluntary sector groups like the Center Project, where we are on the front line? We see a lot of people who need the services, but actually who are likely to come to us or to groups like ours to be able to get the support they need to access the services. How are you looking at that in terms of enabling people to get access to those services?
Yeah, thank you. So it's such an important issue, isn't it, in terms of different parts of the community and different groups of people needing different types of access. I know from previous conversations there's been quite a lot of thought and work done in this area. I'm not sure who would want to pick this one up. Alison, from a commissioning point of view, perhaps I can turn to you first and then maybe get a service perspective from LPT as well. But Alison, any thoughts on this?
Yeah, absolutely. First thing that I'd like to say to Eric is thank you. I think the Centre project is absolutely fabulous. So I know you do some amazing work. So thank you for that. I've got a history myself. I used to work at the Dawn Centre. So I'm very much interested in kind of working in terms of homelessness, etc. So in terms of the digital exclusion, this is something that has already been raised, to be fair. So because we're not only talking about the digital exclusion for people when they're accessing the Centre project, there's a lot of talk around when we're talking about people with dementia. So those sorts of challenges as well. So it is something that we're mindful of, and we're looking to see what we can do to make sure that things are accessible to all. So in terms of there's also some work that we're doing with our public health colleagues. So there's looking at rough sleeping. So, and we're actually just putting together a piece of work for that as well. So I don't know if you might have been involved in some of those conversations, Eric. I would hope that you might have been. And if not, I'd want to make sure that we pull you into that conversation at a future date. So maybe if you can be emailing, so to give me your contact details, because I don't have them, because I'd certainly like to do some further work with you, if that's okay, Eric.
Yeah, I've not been involved in those conversations so far, but it's something I would be willing to be part of and contribute to.
So absolutely, because I think the main thing for me is ensuring that we are working together as we go forward with any of these projects and programs. So, but yes, please drop an email into that email box so that I've got your details so I can come and track you down, please.
Okay, thank you.
Thank you, Eric.
Brilliant, thank you. Thanks very much. Rosie, did you want to come in on the question on the voluntary sector? Or, sorry, Gordon, have I cut you short? Did you want to come in from a service point of view before I turn to you?
Yeah, I can mention it briefly. I mean, I think it's a really interesting point, isn't it? So, look, the vision, I think, is if you talk to people, the public, people whose family members have been involved in mental health services, service users and carers, they all say the same thing. At the localist level possible, so closer to home as possible, can all the different services that do lots of different mental health, from what we call primary and preventative, so lots of voluntary sector organisations and organisations like LPT and GPs, how can they work better together so that there's a proper system of support for people, regardless of what the organisations are called? So in answer to Eric's question, absolutely. Not as part of this consultation directly, but as part of the work I referenced earlier, Eric, the wider bit around neighbourhood. So yeah, what we're doing with this consultation is we're trying to get LPT services better joined up. But the next stage is how do we get all of the mental health services better joined up and better integrated? And that would mean organisations, particularly some voluntary sector organisations who feel isolated sometimes, who find it difficult to access services. How do they feel genuinely part of a system and genuinely supported? And that's only going to benefit service users. So that's the vision, and I think we'll get there.
Great, thanks, Gordon. So I've got a question to come back to on the voluntary sector. Then there's a couple of questions about specific issues regarding Rutland, a question in the chat space about older people services, and Elaine, I can also see your hand is raised. So I'm going to try and work my way through those relatively quickly. Please bear with me briefly. So voluntary sector, did you want to kind of, I saw your space in the chat, did you want to come in and make a point? I can see your hand raised, so I can only see you as VASL. So
yes, sorry, yeah. My name's Maureen O'Malley. I'm charity manager of Vassal. We're a local charity based in Harborough, but we've got many services, and we've got a county-wide talking about family carers. We hold the contract for county council to cover to support family carers. But going back to what we're here this afternoon to talk about is about preventative mental health, and we've become, mightily frustrated within our organisation about how all of our work, everything we do, volunteering, supporting people, isolation, loneliness, really impacts on people's mental health. And a lot of the time, especially through the pandemic, we've got projects and we keep our funding very separated. So we've got lots of projects funded in different ways, Children in Need, Lottery, and they are for specific areas. But we've got very frustrated because there seemed to be nothing for 18 plus to provide company, befriending.
Yeah.
Good bog standard, good old. I've been around a long time. Good old fashioned befriending. So we've put our fingers, hands in our pockets, begged, stealed and borrowed some money, and I've got a project off the ground now for 1 year within the Harbour District to provide wellbeing befriending. So it's for mental health, for low level, to support these people, so have somewhere to talk to. And I've been in conversations with LPT, because we also have a contract for mental health as well through the Wellbeing Recovery Service. How do we access this neighbourhood funding? Because I've got a worker started only 3 weeks ago, doing an amazing job. We're going to be, recruiting volunteers. I can't just have her for 1 year. I've got to find some 3 to 5 year funding to keep that befriending. Basic question. I'm coming up against, I could go to the lottery, but I've already funded through the lottery for other projects. There's lots. I just wondered whether this neighbourhood, I keep hearing about so much money coming into mental health. Can you just tell me where it is, please? And can I fill a form in?
Okay, thank you. Rosie, did you want to come in and talk? I don't know if you can answer that specific question, but I know you wanted to chat generally about the relationship with the voluntary sector.
I did, yeah. Unfortunately, I'm not going to be able to answer that, Maureen. But certainly we can look to working together, and that's what I just wanted to give just a brief sort of overview of the work we are doing with the voluntary sector. So you might be aware with the Mental Health Central Access Point, actually we're working with Turning Point, who are delivering that call handling function within the Central Access Point. We're looking at working with more agencies and partners across Leicester and Leicestershire in terms of delivery of those crisis cafes, and making sure that they are, right in the middle of that community. They're accessible, and actually, they're responsive to people's needs in that community. So I was just going to say, actually, as well, Eric, really looking forward to actually working with you and making sure that you're aware of what our plans are and how we want to work together with agencies like yourself to improve the services and face-to-face support for people. Thank you, Andy.
I think it was just about it's the preventative, because a lot of the clients that we'll be talking to maybe have never even been in the mental health system, and the work we're doing with them is going to, enhance, build their community, build them back into doing things, volunteering, whatever, making connections. So they won't even, GPs are bouncing them back to us before they've even been referred anywhere. So I suppose basically we're going to have to go elsewhere for funding to support those sort of projects.
Yeah, okay, thank you. Well, we certainly heard the point. I think if we're able to kind of point you in the direction after a bit of reflection, we'll certainly do so. And thank you. Oh, Alison, did you want to come in on this? You may have a
just
way forward. Yeah.
A quick response. It might not give you the total answer that you want, Maureen, but we are currently working and looking at how we can implement some grant programs. So you might be aware already of the Shires grant. So that's obviously only in the county and Rutland. It's not in the city. So what we're currently doing is having those conversations to see how we can explore that grant program to enable people to apply for those. So it's a little bit of a watch this space. It is a work in progress though.
Excellent. That's brilliant. That's
okay. Thanks, Alison. That's really helpful. And there's a whole string of information going into the chat box in response to queries covering veterans and a range of other issues. So thank you very much to colleagues for picking those issues up. Okay, we've got a couple of specific questions. I'm conscious, Elaine, you're still waiting patiently, so thank you for bearing with me as I try and get to these questions. We've got a couple of questions here from Esther, specifically relating to Rutland service provision, but also awareness within Rutland of other services. How does everyone know what everyone else can do? I don't know whether or not we've got any comments on those things. Alison, from a commissioning point of view, is there anything that we can update or say about the kind of Rutland position?
So other than the fact that it's very fluid, there's nothing really, unfortunately, at the moment, because we're listening to everybody to hear what they're telling us. So until we have all of the feedback, it's very difficult to give anything kind of set at this moment in time.
Okay, thank you. So Esther, I think what we'll need to do is to hear the point about there needing to be more clarity about service developments in Rutland. We have talked a little bit about the crisis cafes. I know there is a Rutland health plan being developed under the auspices of the Health and Wellbeing Board, and certainly we've contributed a great deal of information about aspects of physical health, both in primary and secondary care. But I take the point entirely about mental health and also the awareness of other services. That's a key issue as well. So I think what we'll do is take those comments away and see if we can come up with a response rather than try and answer them now, if that's okay. Okay, Elaine, let me bring you in, if that's okay.
Hi, thank you. It's great to be here this afternoon. I'm from another voluntary organisation, Home Start Horizons, and we support families across Leicester City, most of the county and in Rutland as well. And I think a lot of the questions I have about inclusion of voluntary sector organisations have already been raised by the people, so I probably don't need to recap on those. And I applaud your intentions to work more closely and the communication between ourselves and LPT would be amazing. I also really like your one-stop information points for services, which was in the video. That's great. We want to help families. We want to point and signpost families in the right direction in the most effective way. So that's going to be a really good resource for us. 60% of the referrals we see year on year are for either diagnosed mental health issues or people with low mood, so it's the preventative stuff. So they've got symptoms of mental health conditions, and we provide a range of services really, which are befriending services. So pre-pandemic, that would have been home visiting, but we're doing telephone support, we do walks in parks, we have groups, we used to have groups, we do groups meetings in parks now at the moment, and returning to that sort of stay and play group delivery. And we also have ran successfully for a number of years. It's called Mums in Mind, so it's postnatal illness support groups, and we've worked hard in the last year to make that a virtual offer as well. Around a third of our referrals come from health visitors as well. So we're recognised and trusted by health visitors who refer into our services and know that they haven't got the time to be able to give support to new families. And I think it's just sort of saying all of that out there. We would love to be able to have closer conversations with LPT about the best ways to promote the services we're delivering, to have some involvements and advisory from LPT as well, either from health visitors or other mental health parts of the organisation, to kind of feel that we're not working in a silo, and that services that we're offering are not being repeated elsewhere, because that's just not in anybody's best interests, is it? So
yeah, no, thank you. A really good point. And you know, it's helpful to get you know, this kind of feedback and to look for opportunities to connect. So we've got your details, Elaine. I don't know if there's anything further you'd like to share with us on that, but
thank you.
You know, colleagues here have heard that point, I think, and we'll look to try and see if we can pick that up both on the commissioning side of things. I'm sure Alison's heard that, but you know, we've got Gordon, Rosie, Cammy, other colleagues here. So thank you for that offer and for that feedback. That's really, really helpful. Okay, let me just quickly take stock. So we've got an interesting question. Ruby, you've put a couple of things in, one which I kind of skitted past and realised when you were talking about older people, and there were specific references in the video to services for older people as well. So Gordon, I might just turn to you to pick up that, if that's okay. And then you've also picked up this wider question about sport and health providers. And that's quite interesting, actually. There's a range of different things happening in that respect. And again, I think perhaps rather than try and answer that as a question, what we'll do is take that as a bit of feedback to say, look, it's a really helpful suggestion for us to understand that those opportunities exist, if that's okay. Gordon, was there anything you wanted to go, or we can usefully add about the work to develop services for older people?
Yeah, briefly. I mean, I think one of the challenges we've got is to make sure that there's an understandable focus on adult services, working adult age, as we call them. But I think we're working really closely with services for older people, and we are really trying to improve things like the memory service to make sure that we reduce waiting times. With the way that it was mentioned in the video, the way that the mental health for older person services, the 8 services across the community, across the whole system, and the 8 adult services, they're basically on the same, in a sense, space. They're working across the same space. One of the reasons we're thinking about that is because we think that will give a really closer working relationship between adults and older adults. There is some very specific investment into older adults as well that we're expecting to put in, partly to deal with waiting times, partly to improve the psychological therapy offers for older people. There's also some other work going on with our colleagues in the voluntary sector about improving the links between drug and alcohol services and our older services, because we seem to take, historically that's been something that people haven't really paid too much attention to, but it's a very, very important piece of work. And also we're doing some very specific work around thinking about suicide and older adults as well, because again, we talk about younger adults within that context, but it's by no means only younger adults that struggle with their mental health to such an extent that self-harm and suicide becomes an issue. So yeah, lots of thinking, lots of work. It doesn't always get, I think it's fair to say, Andy, it doesn't always get the kind of coverage that I think, and that's our fault. I don't think we talk about it enough, actually. And I think it's one of the things we need to do better. There's a few things I think that have come out of the conversations over the last month or two. Carers, improving the support for carers is a big bit that I think we need to kind of do some real work on and think about, and making sure that we are really clear about the investments going into all the person services, and how can we can improve dementia services. And linking it back very quickly to finish off, specifically around dementia, we know that certain communities across LLR don't necessarily access our mental health services for older people in the way they'd like. Sometimes to do with stigma, sometimes to do with all sorts of other reasons. So again, it's also older person's mental health is very much linked to the wider issue I mentioned earlier about intersectionality. So yeah, lots of focus on it. Also, there's also the other work around, we've got the first 1,000 days work, but we've also got lots of work around aging well and dying well, etc., that we want to kind of focus on as well. So something around bringing all that together over the next couple of years, I think it's going to be really important.
Yeah, thanks, Gordon. Thank you. Again, some really helpful themes to pick up on, as well as hopefully some answers to questions. But we take from the questions asked the kind of areas that we need to do further development work on. So it's really, really helpful. Thank you. I'm just checking. I've scanned through the chat space and the hands up. I think I've picked up all the questions. If for any reason I've missed anyone, could you either just give me a nudge with a hand up or a question? Here's a question in, sorry, just to pick up. So, so are there any volunteering opportunities available in Leicester? Someone at 16 years old. So what sort of voluntary opportunities are there? And maybe other people on the call who can talk about that, but there is voluntary action Leicester, for example. But Alison, do you want to kind of touch this up and touch on this, and perhaps we can signpost people to information about voluntary opportunities?
So I think we're always looking to build that volunteer workforce. And I think there's numerous volunteer opportunities across the system, depending on what NAF or NAITH, so apologies if I've not pronounced it correctly, what you actually want to do and what your interests are, because it would be about linking you with the right things for you as well. So I think we can perhaps send out some information at a later date. So because you could be volunteering at UHL, and doing things around mental health. They have a massive volunteer program, or you could be doing it for probably any of the providers that are actually on this call as well. So I'm sure there's numerous opportunities depending on actually what people want to do. So there's maybe some signposting to be done, Andy, like you say.
Yeah, some very good stuff online as well. Even if you just put in general Google search things like volunteering in Leicester, Leicestershire and Rutland, you'll get some links quite a lot of coordinating organisations that seek to connect people up with opportunities. So definitely encourage you to have a look around, and if there's anything more specifically, then please feel free to contact us. Okay, I've got a question. Let me just read a comment in the chat space from Women for Change. So let me just quickly read that through. Okay, thank you. So that's just to help us to be aware of the work you do. That's really helpful. Thank you for putting that in. Is there anything you'd like to say to elaborate on that? Or are you happy to just notice, for us to just note that from the chat space? Okay, we've certainly picked up that. Thank you for joining today and for making us aware of the work that you do. It's really helpful, and it gives us a chance to connect with you. Thank you. And Cami, thank you. I can see that you've put a link for volunteering opportunities. That's great. Ruby, raising issues about art and music. This has come up actually in previous consultations, and I think there is some work going on. I'm not sure. In previous conversations, other colleagues have talked more about this than I have, or people on the call now. I'm not sure whether anyone can add specifically to that today, but we certainly will take it as feedback, and we have looked for opportunities to do some more imaginative work around that.
Andy, we've got loads going on, if I can say, within
LPT. Gordon, please.
It's one of those. LPT's had a history of this, well predates us, that really is involved in arts and music, and we've got dedicated art workers that work in LPT. So Cami, I think it'd be helpful if Cami, and they're involved in all sorts of community stuff around both music and art. And it'd be helpful if Cami can put some links up, or somebody can put some links up for people to look at for the website, because it's amazing stuff, and it's been kind of nationally recognised, I think, as being really innovative. And if people don't know about it, they should do. And perhaps, you know, if people can have a look at that. There you go. Cami's already emailed there.
Fantastic. Thank you. So really good, and these kinds of connections, these opportunities for art, music, you know, really helpful. And some of the most interesting and imaginative work actually goes on in these kind of boundaries between areas. So it's really helpful. Thank you. I've got a hand raised for Women for Change. So would you like to come in?
Yes. Hello, Andy. I don't know if you can hear me well.
We can hear you. Yeah.
Oh, brilliant. Okay. I was writing on my the comment when it just sent, so sorry about that.
That's
yes,
okay.
There is I'm absolutely, these events, consultation events, is really well needed. And during the COVID, we've been running a helpline called Befriending Service, and we've had so many calls from women and young people. And few gentlemen, but the thing is, with the community, there needs to be a lot of people, colleagues in here have already said, the voluntary sector, there needs to be support, there needs to be, the community-based programs going on for communities that understand. Because if with the COVID, with Black Lives Matter, with what's happening at the moment, Palestine, with people losing financial during COVID, financial aid, their work, income, their salaries, people being isolated with young children who have autism, and they've not been getting those kind of support they were getting from the schools or the health visitors or what have you. It made people very much isolated, and it made them very not only lonely, but the fact that there is, they have kind of underlining mental health issues. I'm not a health professional, so I've linked up with Dr. Samira, who's in this call, and the Somali health professionals, who then really looked at, and they've organized themselves. And I'm sure Dr. Samira can go into that. But the thing is, what we need on this call is to do more, and different communities, go through differently, and they need different needs. And that's all I wanted to say. And the fact that, one big great example is the COVID-19. When we've contacted you and we've worked with your colleagues and what have you to be able to put in, we recognized there was a hesitance in our community for taking vaccines. And look how great now the numbers are and how amazing it is. So when you work with partnership with communities and you listen to them and you support them, things really do happen and we make a great impact. That we do have single women, single mothers that we work with, and they usually say when they call us, oh, I don't want to go to my GP because I don't want my children to be taken away from me for social services will take my kids if they know I have a mental health issue. So again, trusted voices do happen. They trust, us, they trust, the doctors and the health workers within the community to be able to say, I know that, you will get me the support I need. I know you're going to get me the signposting to the right people. But if I go to my GP who does not know about my life and my situation, they probably might just take the wrong lead, which is not the correct understanding of it. So again, representation and awareness and education really does go far. And we do need that help to be able to push through that people can get help. And we would love to work with you guys to be able to get that support, whatever funding is available, and to work through utilizing what we have in our community, who are the Somali health professionals that are absolutely been doing a great work with the COVID-19. Thank you very much. Sorry, I took.
Brilliant, thank you. No, look, that's really helpful feedback. Thank you for joining, and thank you for both the offer and the ask, really. And I think colleagues will have heard that. We'll look for opportunities. Some points really well made about how important it can be when you get really good engagement with, through and with community groups. So thank you. I'm not sure if colleagues want to comment further. I think mostly we heard what you said. I think is probably the correct response. I'm really keen to take up the opportunity to partner with you. So thank you. Are there any other questions or issues? So Jane, just having a quick read.
The answer is yes.
Thank you, Jane.
The answer is yes. Yeah, I think we would be interested,
Yeah.
actually. We're talking with local councillors here, aren't we, around community gardens, allotments, and I know it's something that Councillor Dempster is particularly interested in. So we'd be really interested to know how that goes, Jane, if you want to link in with us.
Great, thank you very much. Okay, we've been running for just over an hour. It's gone by incredibly quickly, actually. Thank you. It's been a very active session with lots of really great questions and areas to discuss and explore. I hope that we've caught everything, and thank you very, very much for the comments that you've put in. I'm speaking slowly, but I'm just making sure I haven't missed anything, and making sure people have got a chance if they have any kind of final comments. But look, it's incredibly helpful. Thank you to get the feedback, such as the feedback we've had. We never fail really to benefit from these conversations, either in realizing there's another partner we can work with, or getting some connections with extra work that's going on, or simply understanding the perspective from an individual or from a part of the community. So thank you genuinely and sincerely for your time in participating in this process. We've got a couple of slides. I'm not sure if we can just share those. Yeah, brilliant. So there's a whole pile of information on this slide about where you can get some further help and support, either for yourself or people that you might be concerned about in relation to any or some of the issues that have been picked up today. So I hope those numbers are helpful, and we'll leave them on the screen just for a moment longer so that you can see lots of different places that can provide support for all sorts of the issues raised today. And we also have some further information about how you can participate. So we try to talk and listen and communicate all the time, but this particular process is a specific public consultation. So we are trying to encourage people to particularly respond at the moment to the questions and issues. And what you can see on the screen here are the ways in which you can do that. So you can find out more on the website. There's telephone numbers there, there's an email number there, there are some social media connections there as well, for you to both understand what's happening and also have an opportunity to comment or participate in the consultation process. As you can see, it runs for quite some time. We're not due to conclude the consultation until the 15th of August. But your comments and inputs are always welcome. So we're particularly trying to capture them during this 3-month consultation. But to be honest, we're really keen to have the dialogue with you at any point, and always grateful for your views and thoughts. So thank you. If there's nothing further, let me just, I can just see one more comment coming into the chat space. So great, thank you, comment, that's really nice. Thank you very much for that. For those thanks. Look, from my point of view, thank you all very much indeed. A big thank you to colleagues who've been up front in responding to the questions or clarifying from all parts of the service. Thank you very much to those people who've been beavering away behind the scenes to put links and to make the whole thing work properly. But most especially, thank you to everyone who's participated this afternoon in this event. It's been, as always, actually really great, but particularly today, I think, to get such a spontaneous and wide range of feedback and connections. So incredibly helpful. And thank you very much indeed. I hope you have a good rest of the day, and we may get an opportunity to catch up in further of these events or in some other way over the coming months. So for now, thank you very much indeed, and goodbye.